So let's start. Hi, my name is Kayleen. For those of you who don't know me, I've recently joined the Norfolk Chambers. I'll be looking after the full events programme. So I'm very pleased to announce that we launched our July offering yesterday. So thank you so much for attending. I've put in the chat function the events link, so feel free to view this after the webinar and book on any others that take your fancy. They're completely free to attend. We're also extremely excited to announce that we will be doing our first online panel discussion in July, which will be on how to effectively lead remotely. This will be available to book on our website later on today. So, as lockdown eases, many companies are planning how to bring their staff back into the workplace. However, it's imperative that employers ensure the workplace is safe and appropriate measures are in place to protect staff. This webinar will look at what companies must consider in response to new world we now live and work in. Andy Hook, who is the Health, Safety and Training Business Partner at Quest, will be presenting today's webinar. There will then be a Q&A afterwards, so please use the Q&A function when you have a question. Andy, over to you.
Hello, good morning everybody, and thanks for coming today. Thank you, Colleen. Well, without further ado, we'll make a start. So, as Colleen said, I'm Andy. I am the Health and Safety and Training Business Partner for Quest Business Services. Today we are going to be looking at returning to work safely after a COVID-19 lockdown. So that is how we can prepare our business and make sure that we are keeping people safe and adhering to regulations. So a bit about us. As a company, Quest, we've been around for about 25 years. We support lots of businesses across the UK, across many different chambers and trade associations, as well as a lot of direct clients. We offer many services, including HR, health and safety, tax and VAT, insurance and legal. I'm sure most of you that are here today that are members are aware of that service, but it is something that we do offer, and you can call in for advice on our advice line service, whenever you like, really. Just run things past us if you need that support. We're based in Thurmaston, Leicestershire, which means, yes, we are in the lockdown area, but we'll come more onto that in a little while. The health and safety services we do offer includes many things, including audits of sites, safety management, support with legislative documentation. We do training, we do all sorts, to be honest, as well as our telephone advice to members. We also do a direct consultancy service, and on our website, and there's also an awful lot of documentation that is accessible to both our health and safety clients, but also to members as well, which I will talk about at the end of this webinar. I will touch on how you can access those documents and where they are, which are freely available to you as chamber members. So I'll start with why do we have a duty is really the question. Why do we need to do something about this? So, as the nature of COVID is highly contagious, I'm sure that's no surprise to anybody. So we really need to take steps to control the virus. As an employer, we've got a duty under sections 1 and 2, and to others other than employees under section 3 of the Health and Safety at Work Act, which says, so far as reasonably practicable, we've got to protect employees from harm and protect non-employees from harm, and not allow harm to come to them from doing something or not doing something. It goes a bit further to say, in the Management Health and Safety at Work regulation, section 3 requires a suitable and sufficient risk assessment to be completed. And if you've got more than 5 people, you've got to have that written down. You may or may not know that, but that is a really important thing. You need to demonstrate exactly what you're doing to control the risks. This is where in this context, the COVID risk assessment comes in. You've got to bring it to the attention of all your employees. There isn't a statutory requirement for you to share it on a website. You can do that. There is a mention in some of the guidance, the government guidance, that you can share it on a website, or I think it may even use the word you should share it on a website. There isn't a statutory duty to do so. as long as you are bringing it to the attention of all people that are going to be affected by the risk there, then that is fine. However we choose to do that. So at the moment, as we know, there are certain restrictions on some businesses across the country. It's obviously starting to vary a little bit in some areas, but certainly talking for the England regulations, we need to make sure that we're permitted to open. The majority of hospitality businesses now will be following, as we know, from the 4th of July. But there are still a fair few businesses that are not permitted to open. As I'm sure is been very publicised in the media, Leicester is one of the first, or is the first city in the country to be subject to a local lockdown, which started this week. I say we're based in Leicester, so we're a part of this. As such, it doesn't apply at the minute. The opening, as you know, things have been reversed. So if any of you are looking at business in the Leicester area, as I'm sure you're aware, there is a restriction at the moment for travelling in and out and around Leicester because of that. That is going to be reviewed on the 18th. There are certain other places around the country, obviously not specifically about Leicester, but just as a whole, places aren't permitted to open. So there's things like soft play centres, indoor gyms, leisure centres, spas. There's quite a few other places as well when you look at it. So I would always advise to look at the list that you've got, which is available on the government website there, and that is kept up to date. So the legal responsibilities of employers, and let's talk a little bit more about that. The Health and Safety at Work, etc. Act 1974, Section 1 says that we need to, as far as reasonably practicable, look after the health and safety at work of employees. And Section 2 really breaks this down a little bit to say, certain areas that actually we need to be concerned with under that heading. And to simplify that, so far as reasonably practicable, you've got to provide safe equipment and safe systems of work. So that is making sure that people are provided with safe work equipment, that they're able to work safely, and that they understand, a safe method of working. So this certainly applies in the context of COVID. Actually, what procedures have we got in place to allow people to come safely back into the workplace and not be put at risk? We need arrangements for the safe use handling of substances. So perhaps from all of this, you are likely to have introduced other substances that you may not have had before. Antiviral cleaning products, antibacterial cleaning products, alcohol gels that you may not have had before. Do we have a suitable system in place for assessing their use in the workplace? These are all things that we need to consider. We need to train employees, so don't just assume that people know what they need to do, but actually talk to them, train them, advise that this is the procedure. When you arrive for work, we're perhaps going to stagger your work time, for instance. We're going to expect everybody to change into something, into a protective clothing, for instance, in some workplaces. People change out of outdoor clothing in other workplaces, but make sure that people are really clear what they need to do. Hand washing is definitely going to be another one. Alcohol gel. And this really says that we need to provide a safe workplace that's maintained safely and allows us to get in and out safely. So managing start times and finish times certainly would come under that. Are we able to provide a safe area if we've got a lot of employees wanting to get into the workplace at the same time? Are they then going to be putting each other at risk by being in close proximity to each other whilst in changing rooms, for instance? So how do we manage that? Adequate facilities, of course, must be available. So that is for people to wash their hands, but also, just general welfare facilities. Actually, are people able to access clean drinking water? Are people able to access suitable facilities, kitchen facilities, where the risk of COVID is controlled? And we'll talk a little bit more in detail about various different areas in a little while. Section 3 is the duty to non-employees, people that are not your employees that are coming onto site. So you might have contractors, you might have people working for you that aren't your employees, but actually we do still have a duty to them. And the subsections 1 and 2 of that says that you mustn't expose them to risk to their health and safety, and you've got to give them information on anything that might affect their health and safety. So this is where people that are not part of your business, may not be fully aware of the training that you've given to your employees and the employee meetings, for instance, that you might have had that explains how we're going to manage things. As visitors and people that are not part of your business, they may not be aware of that. So we need to provide them that information through perhaps an induction process, or even having clear signage and clear processes on site of exactly what we're going to do. Now, when I talk about what's reasonably practicable, not everybody understands what that means. So I'll briefly just touch on that really. And for those that aren't sort of aware, the reasonably practicable phrase really comes down to balancing the cost, time and effort required to implement a measure, and balancing that against the degree of risk. Where the degree of risk is great, then of course the cost, time and effort that's required to mitigate that risk is going to be much higher, thus to balance the scales, as it were. You aren't required to do everything, and you simply couldn't do everything as much as you perhaps want to, but we need to do what is reasonably practicable in that context. So, looking at the risk and actually looking where we can do things and doing what the reasonable person would do in that instance. Is it reasonable, perhaps, to provide everybody with suits like this that come into the workplace? Maybe in some work environments. Probably very unlikely in most work environments. If you're working in an office, for instance, probably unnecessary. But it is something certainly food for thought. Probably not reasonably practicable in an office, depending on what you're doing, of course. It could well be, based on your risk assessment. But maybe reasonably practicable in other areas, perhaps in somewhere dealing with healthcare waste, for instance, or something that, where there is a high risk of contamination, then the risk is up somewhat. So, of course, we would then look at other measures. So the legal responsibilities really is that employees also have responsibilities. It isn't just the employer. The Health and Safety at Work Act says that under Section 7, employees have duties to look after their own safety and look after others' safety, don't put people at risk. And they need to cooperate with their employer and work safely in line with their systems of work. Raise safety concerns they have. Don't just sit there and think, well, it's not my problem. It's, employees should be encouraged to come forward with issues and discuss it with their employer. They must report any symptoms, of course, of any risk where they could have been infected, or they've been in contact with people infected, or they've got symptoms. They should be self-isolating in line with the Public Health England guidelines. And as I mentioned, they must comply with their employer. So if you've got employees that are resistant, that you actually put control measures in, and employees are resistant to that and are refusing to adhere to the rules that you put in to keep everybody safe, it might be worth just reminding them that actually they do have a duty to cooperate with the employer. Where we're putting measures in to keep you safe, actually you need to do your bit and actually work with us and allow us to keep you safe. Excuse me. So risk assessment then, the all-important COVID risk assessment that everybody keeps talking about. What is it and how do we do it? For those that have done risk assessments before, I'm sure are fully aware of this. Those that haven't, we'll certainly go through it. In the context of COVID, we need to look at, of course, like all risk assessments, what is the hazard? First of all, we need to know that. We need to know who's at risk, how are they going to be harmed, and what are we going to do about it? So the hazard is COVID. Of course it is. It's the transmission of COVID leading to illness. And who is going to be at risk? So we look at specific groups of people here, as well as just employees as a whole. So that might be people that are undertaking certain roles that may be at a greater risk, people that are required to work in close proximity or in an enclosed area, where it might be difficult to implement social distancing. It might be difficult to implement ventilation. Visitors, of course, you're not going to be aware of their health condition. So, taking measures really, due diligence really there to speak to visitors that are coming on site. I mean, I would avoid, obviously, unnecessary visitors at this time. Certainly, we're reducing that risk. And I'll talk about the hierarchy of control in a little while. But, first stage really is to eliminate the risk. So if we can, certainly don't look to have people on. That eliminates that problem. However, sometimes it's going to be necessary. You can't get away from it. but just take steps to be sure that actually they aren't coming in and are likely to contaminate the workplace and infect people. Any older people have, as you will know, been identified by the government as at higher risk. Those identified as vulnerable through underlying health conditions, or those that were advised to shield, of course, are all higher risk people. There's certainly areas that we need to look at and look at specific controls and how we can keep those people safe. So how are they going to be harmed? So they could come into contact with somebody, they might not maintain social distance and contaminated air, etc., the droplets that are in the air, contamination from surfaces and poor hygiene practices in the workplace, people not washing their hands properly, are all going to be real key areas where it's likely to infect somebody. And we need to then know what we're going to do about it. So this is the actions we're going to take as a business or as an organisation to control and mitigate that risk. So that is the things like the social distancing, how desks are going to be laid out, how tables are going to be laid out, you know, in the hospitality context, for instance, how transport's going to work. You know, if we're a business that has company vehicles that you know go out during the day, visiting, delivering, etc., how are we going to do that? What do we do about visitors coming in? Have we got a process to manage them? And really, when we're doing a risk assessment, the hierarchy of control is the first thing that we need to always think about, because the hierarchy of control tells us exactly what order we need to follow through with the controls that we're implementing. So always when we look at a risk, we look at a hazard, we look at how we're going to control it, we first want to look to eliminate that, as I mentioned with the visitors. If we can eliminate visitors coming in, brilliant. Again, apply this to any context, not just visitors, but I'm just using that as an example. The elimination. So, right, we've got rid of people coming in. I'm sure visitors may object to being called a hazard, but you know, sometimes we just don't know, do we? It's the unknown. So if we can remove that altogether, brilliant. If we can't eliminate it, can we substitute it? So could we perhaps, we need people to talk to us in the business. Can we maybe do it via video conference? Could we do it socially distanced in the car park? Could we, you know, do it in a different way to manage that risk and replace that risk with something less dangerous? We then need to look at things like engineering control. So that is the physical barriers, guarding, separation of people. So actually putting people in separate areas. Your perspex sheets that are in many retail shops now, you know, that is a perfect example of an engineered control there. Something physical that we've put in to isolate people. The administrative controls really isn't as complicated as it sounds. It is changing the way we work. So a procedure, training, a system of work, as I mentioned, you know, in the training element of it, actually just people understanding how they need to do things. It may be enough for, you know, one employee to be told to stay over one side of, you know, production area and another employee stay over the other. Actually, they're not allowed to mix equipment. They keep their own equipment where possible, etc., etc. And PPE is your last resort. So if we're not able to control all the risk and there is still some residual risk left over after we've done our best to control everything, then we can look at PPE. But as I say, it is a last resort, and only when we've exhausted everything else. And the reason it's sort of depicted in this way is really just to sort of demonstrate the effectiveness of the control measures. Starting at the top, of course, elimination is the priority because it's going to protect everybody. The further we move down the list, it's only going to protect those people that are wearing it and the people that are immediately there. If you know, PPE, for instance, if I'm wearing a mask, it may well protect me, but actually it isn't necessarily going to protect everybody. Depending on, of course, depends on the type of PPE that they've got. But generally, the risk and the control reduces as we move down. So we always want to aim to eliminate if we can. So when we're risk assessing people coming into the work, I can't overstate this enough. At the moment, employees should work from home where this is possible. For those who are working from home on a long-term basis, the risks associated with display equipment should be controlled or must be controlled. The HSE says that we do need to do that. And that is things like completing the workstation assessment at home and you know, giving a general advice to employees on how they can be safe. That said, the HSE also go on to say that there is no increased risk if it's temporarily. So in that situation, the assessment isn't compulsory. It's still a good idea to do it and provide guidance, certainly on it to sort of a lower level, but it isn't something where we need to think too formally about it at that stage if it is only temporary. However, given how things are going at the moment, it is likely to that some that certainly were on a short-term basis is now becoming more of a long-term thing. So it's certainly something we probably should think about. And we need to provide advice to employees. So we need to say about breaking up long spells of DSE work, give people 5 minutes, tell or remind people to take 5 minutes, between jobs every hour, actually, so we're not staring at the screen continuously. Avoid awkward and static postures by changing position, getting up, moving around, stretching. Certainly, one question that's popped up a lot to me is more and more people are working at home. They're sitting on their sofas, working in an uncomfortable position, and they're suffering with back pain. Well, actually, as an employer, we perhaps should be proactive about that and give employees advice, and that's something that you can speak to us about. There is advice that we can give on that, specifically on setting up workstations and things. HSE will also provide a lot of resources on that. We also need to tell people avoid high fatigue, so change focus, blink from time to time, don't just stare at the screen. So still in the context of risk assessment, one thing not to forget, which is something that at the minute isn't at the forefront of everybody's mind, but is really statutory duties, areas that may have been forgotten about because actually we're prioritising the COVID things at the moment. As difficult as that is, we do still need to remember we have still got statutory duties as well that we need to remember, and some of those really the key ones that do get forgotten about, and ones that I have had recently conversations about, are the duties under PURE. For those that are aware, PURE is those that are not aware, PURE is the regulation that controls work equipment. So it manages and says that we need to make sure work equipment is maintained, it's in a safe, maintained in efficient state, working order, and in good repair. That extends to equipment that's working from home. If people are using laptops at home, people are using company-provided equipment, work equipment. Doesn't involve their own personal kettle at home and their own equipment in the house. But if it is work-provided equipment for use of their work, then it is. And we've got a duty to look after that, as well as equipment in the workplace. Perhaps if you, depending on your type of business, you may run machinery, as an example. Has that been inspected recently? Have you followed your statutory inspections on that? Do you use pressure systems, for instance, in your workplace? That there's a statutory duty there for you to have them inspected. And if we haven't done that because we've been locked down, we may have missed that. Is that then something that we need to look at really before we're allowing people to use that equipment? Similar to electrical equipment, again, a common one is PAT testing or PAT. People have missed their appointments and things that were in sort of March, April, May because of COVID. Well, actually, now we're going back to work. The equipment is now overdue. If we've got a testing regime in place of whatever it is, again, PURE says that we need to maintain that equipment. So it's worth looking at that to make sure things are brought up to date. Another key area, without boring you too much on all of this stuff, sorry, apologies, but the manual handling is certainly a really important area. Employees that have perhaps been furloughed, or employees that have been working from home, perhaps haven't been doing manual handling like they would ordinarily in the workplace. It's a good idea really to just give them a refresher and make sure that they are going to be working safely and they understand how to lift safely, how to move and carry things safely in the workplace. So after sitting and not carrying that job out, actually they're not then going to cause themselves an injury. And we need to document that actually we have done that refresher training with employees. And make sure, lastly, really, that your general risk assessments are up to date. It isn't just your COVID ones, but actually your general workplace risk assessments for everything else. The same thing applies. You must have them in writing if you've got greater than 5 employees, and they must be kept up to date. So certainly where things have changed lately because of COVID, probably could be a good time to review your other risk assessments, just to ensure that they are up to date and they feed into the safe systems of work that you've got in place across your business for other areas. Another area is Legionella. So where businesses have been sat for some time, the water system may have been sat stagnating. Of course, there's a risk there. Employers have a duty to manage the risk of Legionella in the pipework. Certainly where things have been stagnated, where it hasn't been cleaned, air conditioning systems that have been sat, perhaps damp and haven't been used. Again, there's a risk there if they haven't been disinfected for some time. So we need to look at flushing those systems through, making sure that the water outlets that haven't been used haven't got stagnated water in there where there's a risk of Legionella. We need to make sure that we're looking at any shower outlets or spray outlets that we've got, and make sure that they are dismantled and cleaned properly to remove any bacteria and any contamination that's in there, because certainly they're a higher risk because it creates an aerosol effect in a shower which can easily be breathed in. It's exactly like droplets of COVID. If we think of it like that, it's going to cause you problems. So Legionella is a massive issue, and it's something that you can read more about on the HSE's website without me taking you through the full history of Legionella, but just something to be aware of and certainly have a look. Again, we're here whenever you like. Give us a call if you want to talk it through, you want advice on that. We can talk to you, there's no problem. We can provide you advice. That's what we're here for. Give us a call on the advice line. So we look at managing the risk in the workplace. Of course, there's the government advice and guidance that they've got in place. But it's important to remember, and this is a commonly confused thing that a lot of people ask. Actually, it isn't legally binding. It's something that gives advice on how we comply with the legal obligations, a bit like an ACOP, I guess. In the health and safety context, it says how we should do it. Your duties fall under the statutory instruments and regulations, but in a nutshell, we need to, so far as reasonably practicable, protect employees and others from harm. That is the be all and end all. We need to again look at visitors and non-employees. So the Employers Liability Act, the Occupiers Liability Act is another key area to look at. Actually, where we've got people coming into the business, whether they be there lawfully or not, in some cases. There is still a duty to manage and ensure we aren't causing them harm. But in the context of this pandemic, to protect people, really, we need to look at minimising infection coming into the business. We need to ensure we're not transmitting it and reduce that transmission risk within the workplace, and eliminate the contamination that may have got into the workplace through hygiene. So we think of it as layers of safety. In the safety world, we talk about the Swiss cheese model. Which is a genuine thing, I promise. But it's where we've got layers of safety. You think of it as a Swiss cheese slice with a hole. If one layer and we've not managed to stop the infection coming in, we've hit another layer with more holes that actually we've reduced that transmission risk. But actually we've still made it through to the next slice. Well, actually we might get stopped on that one, and we've eliminated it through the hygiene there. So somebody may have touched the surface, but we've cleaned it up. We've made sure it's not then a risk to somebody, or we've reduced that risk to somebody. So to minimise infection coming in, we need to look at giving clear instruction, as I mentioned earlier. Explain to employees exactly what they need to do. Give a clear procedure on identifying symptoms and notifying the business. It's no good turning up at work and saying, I've got symptoms, I need to go home. Actually, employees should be told, no, don't come near the workplace. You isolate yourself. You inform us by whichever means you've agreed. So that may be, generally a call. In some businesses, they've adopted a text system in the interim for this. Isn't the ideal situation, but we're in unprecedented times, to use the phrase. But certainly a call. Make sure that people aren't then putting people at risk by coming in. If somebody does have to self-isolate, due to their own or somebody else's, what are we going to do about it? How do we manage that? Certainly, the government have said, where there are situations like that. Although, of course, the furlough scheme is coming to an end. It is an option if people are eligible that have been furloughed, obviously, as you know, for the qualifying 3 weeks in the period, in the qualifying period. It is an option that potentially they could, that could be utilised for that, to help. But certainly they are entitled to sick pay as well if they take sick leave. And I believe at the moment it's from day one for COVID-related matters. Encouraging employees to avoid public transport. So can we put a system in place where maybe we encourage employees to cycle in, for instance? Can we, put incentive on them to do that? Can we provide extra facilities perhaps for people to keep their bicycles safe? Something, that we can do just to avoid people coming in on public transport. Perhaps we prioritise, actually, if we are having people working from home, those that can't get to work, other than using public transport, do we consider that there and look at that as actually we need to put a system in place here so people aren't being put at risk and aren't being forced to use public transport. Those that are, of course, they need to follow the rules and wear the face covering while they're doing that. Should be instructed to follow a good hygiene practice, of course, clean running water, soap. We need to do that as part of the welfare regulations. On arrival at work, certainly get them to do that. Make sure we're doing that for anybody that comes through the door regularly throughout the day, and of course before they leave. So we're not bringing anything and we're not taking anything away, hopefully. Employees obviously wear clean laundered clothes every day that have been disinfected or thermally disinfected, so at high heat, depending on the care labels for their clothing. But certainly they would need to make sure that they aren't coming in clothing that could have been infected, and wearing the same clothes day in, day out. Typical area for this a lot of the time is people with high-vis vests that wear them in some workplaces, and they'll wear them every day potentially. That's the same one, and not necessarily wash it every day because it's worn on the outside of clothing. But actually that could have picked up contamination. So yeah, it's something to be aware of. Maybe you need to provide extras, maybe have laundered, something like that. We need to make sure that we've got gels and a system in place for people that aren't able to access hand washing. So if you've got drivers or peripatetic workers, actually provide them something so they can clean their hands. We need a system for having goods and post delivered. So either we look at quarantining things, 72 hours is the current sort of advice, or do we disinfect things? Do we have cleaning products to do that? Of course, PPE here is probably an area that we would consider using PPE. Certainly as part of your risk assessment is something to think about if we are doing that. It's an unknown. We don't know where that post has been and who it's been in contact with. So, of course, we don't know the risk there, and we don't know where what the risk is. So it's better to obviously be safe. Ask employees when they're coming in is going to be probably one of the most simple things. So we ask employees, actually, have you been in contact with people? Are you likely to be infected? Or have you been in contact with someone that has in the last 14 days? Some organisations, as you will have seen, have implemented temperature checks. So anyone that's got a temperature of over 38 degrees, they're deeming as something that perhaps needs further investigation, and perhaps is deemed as a higher risk. Doesn't mean they've got the virus, but it's certainly an indication that we need to look at that. We do need to make sure consent is gained before we do take anyone's temperature, and really cover that off really through your HR system. Again, call us, speak to us for advice if you need that. We can advise. One thing to be aware of, obviously, if somebody has, was encouraging people to run to work or cycle to work, etc., and not use public transport. If they have, the temperature could be higher because of that. So actually, it might be if somebody does read 38 degrees, and actually maybe have that conversation with them. Have you cycled to work? Have you run to work? Something like that. Say yes. Maybe we might want to sit them outside for a few minutes before we take the temperature again, because actually it might not be a true reading. Maybe the temperature's increased because of the physical activity they've done. Beware, there are obligations obviously under GDPR for managing and storing personal data. Always check with the ICO guidance if you're not sure, but just make sure that we are managing that. It is personal data if we're recording people's information against any temperature records. It might be that we're not keeping a record, in which case obviously it's not necessarily an issue. but just if we are, be mindful of that. So symptoms then. The symptoms at the moment we're saying is high temperature, and that means hot to touch on the chest or back. They don't need to measure the temperature, just be aware of that. A new or continuous cough, so coughing a lot more for an hour, or 3 or more coughing episodes in 24 hours, or it could be worse than usual if they've ordinarily got a cough. Change of taste or smell is a key area that things smell or taste different, or they've lost that altogether. If people have got symptoms, they should be reminded to isolate and refer for a test and get support. If they do get a test, generally it's a fairly quick process. Employees will get a test and then they'll be allowed to return to work straight following negative tests. Following that. Okay, so the guidance on self-isolation at the moment is where we've got somebody that becomes ill. This is the illustration that the government have given, where if person 1 becomes ill, after 7 days, they're able to go out again. Person 2 obviously becomes ill a bit later on. Again, after 7 days from them becoming ill, they're allowed out again. The other 2 people in the household, as an example here, don't exhibit any symptoms. So actually after 14 days of the first person becoming ill, they're then allowed out again on day 15. So that's the way it works. So washing hands regularly, again, just to reiterate that, as we keep seeing in all the campaigns, wash your hands, soap and water for more than 20 seconds. It's surprising how many people I see that don't wash their hands properly and literally get them wet, and that's it. So unfortunately, we do need to make sure we are taking steps to advise people on actually thorough hand washing, on how we can do that. These posters that I've got here are freely available on through the NHS resources on the websites, and you can download them, print them off, use them, just to remind people how to wash properly. So drivers and others visiting sites, I mentioned about giving them alcohol gels, having a plan in place for that. But actually, where facilities are available, it's against the law for businesses to refuse access to welfare facilities if they're visiting for work. So it goes for drivers visiting your premises too. So if you've got delivery drivers that turn up, or some sort of driver that comes in for a reason for work, you can't refuse them access. The Department of Transport and the HSE issued this letter here recently, again, which is freely downloadable on their website if you search for that. But it's basically a letter for employees to carry if they are going out to other sites. They can then present this to somebody that's refusing them access, just to remind them of their responsibilities. You'll see in there it does quote the regulations in there, just as a reminder, really, that they are breaking the law by not refusing access. By refusing access. So we need to make sure that social distancing is maintained. Ideally 2 meters, as we all know. However, guidance now says that if mitigation measures are in place, 2 meters it isn't possible, then 1 meter plus is acceptable. Now we need to, as I say, put mitigation measures in that, so that is actually seating people in away from each other, seating people so they're not facing each other too closely, making sure that where relevant we've got guarding in place, we've got fresh air in place, we've got all different measures to minimise the risk. Signage around the workplace can help to manage that and help people to observe that rule and just remind people, really. Where it can't be achieved, as I said, we did then look at other areas in line with the hierarchy of control, looking at physical screens and guards and things like that. Remember, lifts obviously is going to be a fairly confined area, so that's an area to look at. If we have lifts in the workplace, how do we manage that? You can see there's an example there of how it's being done. But actually try and restrict it if we can. People that need to use them, fair enough. People need to use them, they need to use them, they need to be available. But does everybody need to use them, or are they just choosing to use them? So certainly if we can restrict it, we should. Canteens and rest areas, make sure that social distancing is maintained. taking seats out of use, for instance, in canteen areas, so people aren't sitting opposite each other. People are well spread out. Removing tables even in rest areas, so actually they are unable to sit within too close proximity to each other. Have clearly defined walkways in place, so one-way system where appropriate. Again, making sure people are not next to each other or closely opposite each other. Use screens if need be. You see there's a depiction there that I've sort of demonstrated, actually, where we've got workstations diagonally is probably the safest thing. Certainly not opposite each other, you see there. But yeah, diagonally. Where that isn't possible, and of course we need those people, then perhaps we look at fixed screens, things like that, as you can see in the next image there, just to keep people separate. If it's difficult to achieve, then maybe we'll look at cohorts. So that's dividing the workplace into smaller cohorts. So actually, if one person in a cohort becomes infected, or bubble is probably the easiest phrase, becomes infected, or is suspected of infected, it isn't necessarily going to infect the rest of the workplace, and you're in a safer position there. Similar to what the schools have done, as I'm sure we've all seen. They've divided the places up into small groups. Actually, where if that bubble becomes infected, it isn't then sending everybody home. So to talk about social distancing catering, obviously this is relatively new. The food industry and food hospitality industry. A few key things that the government have said to manage the risk, manage interactions at a venue where there is serving of food and drink. Appreciate that may not involve all of you, or many of you, but I am just going to go through that, just touch on that. Calculating floor space and working out maximum safe capacity is the first priority. Actually, how many people can we have safely in here before we're looking at getting close to breaching social distancing, and we're unable to maintain social distancing? So we need to take that into account, but also take into account seating, tables, things like that. Actually, structural features in there that, divided rooms, for instance, things like that, dividers in areas. Actually, is that having a mitigating effect on it? We need to look at screens to put in place at service points. Make sure that we've got that managed. Where we can, designate a collection point away from a bar, for instance. So we've got maybe at the end of the bar, which is nowhere near the employee. We may have a designated collection point down there. So once the person has placed their order, if you've got no choice but to do it at the bar or at a service point, take the order, but then the person goes and maintains social distancing in a safe area away from the employees, and then collects from the designated collection point once it's safe to do that. The key thing that a lot are talking about at the moment is ensuring a register is kept of employees. Again, we need to make sure we're managing that data in line with GDPR, and we're not sharing that with unauthorised people. Where we've got name and contact details, so we can trace the contacts if we need to. Some other areas encouraging the use of outdoor spaces, so potentially providing parasols where appropriate could help. If there's poor weather, can we encourage people outside still by using parasols or umbrellas or something? We need to make sure that's not going to impede ventilation, because that's going to be counterproductive if we do that. But at the same time, it's something to look at. Table service, we should encourage where we can. To reduce customers walking around the venue, promote contactless payment, have clear signage in place for hygiene and social distancing. Hand sanitisers, of course, key area. Make sure that people are using it. Can we have a one-way flow in the workplace? Would that work? Could we manage it in that way potentially, and have one way in and one way out? Where possible, we should look to do that. Suitable hygiene practices, especially in public areas, so having things clean, sanitised regularly. Have a system in place where perhaps we're doing that maybe every half an hour if we've got people in, or more often depending on your risk assessment. Suitable hygiene practices around condiments and things like that as well. Another area where people are picking up a salt pot, a ketchup bottle in a food establishment. Or something that's in there. Actually, are we cleaning those, or potentially where somebody else has handled it before? is there then a risk that they've contaminated it? Again, if you need advice, speak to us. We can probably help, in your individual workplace, in your situation. Talk to us. So reducing transmission risk, again, we need a system in place for welfare facilities, and we talk generally now about the workplace. So how is your toilet shower facilities, if you've got them? How is that going to be managed? Are we going to have a cleaning policy where whoever somebody's used it, it actually then needs to be cleaned before it can be used again? Have we got a system where the employees can perhaps wipe down the surfaces and things like that after they've used it to reduce the risk? Having a system for changing rooms. So if we've got a lot of employees that are coming in at once, of course we don't want them all in there at the same time using that, because of course that's going to be difficult to maintain that in many workplaces. If we've got small areas, we've got single toilet facilities. Perhaps you can see on the right there the door hanger system. Again, these templates are freely available online. You can obviously put whatever text you like in there, but some businesses have started issuing these as personal issue to their employees, where actually we can, if we're using those facilities, I can just pop that on the door as I'm going in. I know then that people know that I'm using that facility, and somebody else isn't going to walk in and potentially breach the social distancing in there. Kitchens is another one, having something to wipe things down, antibacterial wipes. When I say antibacterial, obviously generally most antibacterial wipes contain disinfectants that are effective against viruses and things like that. Just make sure that obviously we are cleaning effective and we are using the right products. But yeah, having that. Somebody wipes down the kettle, wipe down the handle on the kettle, wipe down the cupboard handles when they've used it, wipe down the taps, just to make sure that we're reducing that effect. Making sure we've got ventilation is another really key, for instance, and ducted ventilation that's perhaps we look at shutting that down in the short term, because if we if we're recirculating that air in some ducted systems, potentially if somebody that's breathing in one area is infected, their droplets in their breath go into this air system, is then spread to the rest of the building through the recirculated air. So if we can switch that onto fresh air, if we can't, then obviously we should be sort of turning those systems off for the time being, and looking at other methods, so having doors open, having windows open, extra ventilation in there. So then we need to look at eliminating contamination through hygiene. Prior to reopening the business, we should make sure we've deep cleaned. Make sure if there's a suspected case or we've had a case, we follow the government advice on decontamination. Again, there is a specific website set up to give advice on that. Google will take you there. Have a look. Soap and running water must be provided, and regular hand washing encouraged. Antibacterial surface wipes, again, they are generally disinfectant, most of the wipes as well. Sprays and disposable wiping material, don't just reuse the same cloth in areas that it's potentially going to spread from one area to another. Make sure employees are given training. As with the first area really that I mentioned when I started, people need to be trained and understand what they need to do. Make sure that they're looking after their own area, so if they can clean their desk down, when they're using it each day, keep that area clear. Make sure employees store their personal items away from in their lockers, away from other personal storage area, rather than being left out in the workplace for other people to come into contact with. If we're using communal equipment in an office or in any environment, make sure we're wiping them down, between users. Make sure we're washing hands, so we're again reducing that risk of cross-contamination from people touching those surfaces. If we've got high frequency contact areas, so door handles, taps, water coolers, bones, IT equipment, make sure they're all decontaminated regularly to reduce that risk. And really just to talk now a little bit on PPE and masks. The common question at the minute is the difference really with masks and face coverings. What is the difference? Well, a mask is what's shown there on the right. Is the simple level. Obviously, there's a million different types, but in its simplest form, it's probably something like that. Has a rated particle filter in it. We need to be sure that we're using the right level. If government advice says that if we wear it for non-COVID related stuff anyway, so we might be protecting against wood dust or something in the workplace, if we operate that kind of business, or silica dust or whatever, we should carry on doing so as we normally would. The guidance says that as a precautionary measure purely for COVID, we should discourage it. If employees choose to wear one, great, we should be supportive, but we should, we should try and discourage it where we can. Reason for that really is people, social distancing is the more important area, and the more important thing, and the good hygiene standards. People can get lulled into a false sense of security if they're wearing masks. So we should try and avoid that. But of course, if a risk assessment determines that you should do it, then we should do it. Training on donning and doffing should be given. Obviously, if people are wearing masks, to make sure they're doing it properly. Don't touch the face, wash the hands first, etc., etc. Make sure they're replacing the mask regularly. Obviously, this type are disposable. If we've got contamination that's on it, potentially, and we're wearing it again the next day, there's potentially a risk there. Then we've got the other type, which are the non-rated, as I would call them, cloth face coverings, which the government have put advice on about creating your own even. I believe it was from using an old T-shirt, I think was the example they gave on their website, the government website, to cut up and turn into a face covering. Compulsory now, obviously, on public transport, but also they're encouraging you to use it in public areas. Doesn't give much protection to the wearer. It doesn't really give any protection to the wearer, to be honest, very little. But the idea is to try and protect other people, so it's reducing the transmission from the wearer to everybody else. Again, there's a link there. You can Google that for the government website, how to make one, and say they use the example of cutting up an old T-shirt to create one. And of course, there's a lot available online, etc. So coming almost to the end then, for those that aren't able to stay, totally understand if you're rushing off. I appreciate we are running a little bit, but we are almost at the end now. So I'll just quickly go through this, and then we'll turn over to questions. So the liability side, a lot of people are asking me regarding if somebody does become infected, and they allege that it's due to me not managing it properly as a business owner, am I going to be at risk there? Am I at risk of prosecution or at risk of being sued? So in the context of the HSE, so criminal liability really on a prosecution, it's possible. The HSE, unlikely unless there's serious offences at this time, to go straight for a prosecution. They could even issue a notice and things like that if there was something serious enough to say that you need to do something else. But I think it really needs to be in the public interest for them to pursue a prosecution. Just because somebody's got the virus, key to remember, doesn't necessarily mean it's come from your workplace. It could have come from anywhere. If they do issue a notice, if they see that there's uncontrolled risk there, it may not even necessarily be COVID related, then of course they could issue a notice. Important thing is not to panic, follow the advice, protect your business for enforcement. If they do get in touch, cooperate with them, get in touch with us if you need it, and we can provide you guidance and support on what to do next and help you through that. The civil liability side then really is the other one of somebody, can an employee sue me if they become ill through COVID and allege that it's my fault? Well, actually, there's 3 tests in civil law that says there needs to be a duty of care to the defendant, from the defendant to the claimant. So that is actually, as an employee, yes, there is going to be a duty of care there, so there's no question of that. Same as visitors, customers, etc., that come in under Occupiers Liability Act and Health and Safety at Work Act. There is a duty, not in question. But did we breach that duty? If we followed the government advice, we've adhered to our legal duties, we've made sure that we've done a suitable and sufficient risk assessment and put all the measures in place, and we've got evidence of that. In law, they look at what the reasonable person would do. So have you done all that the reasonable person would do in this circumstance to keep people safe, for what was reasonably foreseeable risk of harm coming? If we're able to show that, then there isn't really a case that can progress because, we aren't able to satisfy that condition. And certainly there, if somebody does become ill, how are we able to then show that actually that was the contamination did come from your workplace specifically and not from their trip to the supermarket, etc., etc. So yes, it is possible. I think it would arguably be a difficult thing to prove that it was 100% from your workplace, unless you were extremely negligent and it was clear that there was an issue there that you hadn't dealt with. But if you taking reasonable steps, doing the right thing, then I think the risk is minimal. So just to summarise then, we need to conduct that suitable and sufficient risk assessment. We need to identify those who are at risk, as I mentioned earlier, share the findings and implement a safe system, make sure that we're adhering to social distancing, make sure that we're adhering to adequate hygiene, and make sure we've got facilities in place, make sure people know what to do if they've got symptoms and how to isolate and where to go, what to do. Make sure that we're cleaning the workplace as a whole, and we've got a good system in place for managing the hygiene. Statutory equipment, as I mentioned, make sure we don't forget that. As important as the COVID matter is, it's also important to remember the other stuff. We've got an awful lot of free resources available on the website. The Chamber will give you access to your login details if you haven't already got them. I will quickly show you how to access that. Just really, once you've logged in, there'll be a link that you've got that will take you into your specific login screen. If you've not got that link there, you can just go to questcover.com/chamber-index. It will bring up the list of all the chambers. These are all the chambers we support across the country. You can go to find your chamber on there. It'll bring you to your login screen, as I'm sure some of you will be familiar with. Once you've got in past that login screen, it will bring you to another area. It will bring you, and let me show you my demonstration one. Excuse me. It will bring you to the there we go. The login screen here. It will take you straight into the document library. This is where many of your risk assessments, your safe working instructions. You've got a whole plethora of things in there. There's everything you can think of from the HR side and the health and safety side. Just specifically regarding COVID, if we go into the document library, into risk assessments there, scroll down, and we can see there we've got your COVID risk assessment templates at the bottom there and guides. There's also risk assessments and guides on just about everything you can think of in there, including policies, procedures, things that we need to manage. But it's certainly worth having a look at that area when you get a chance. So, almost finished. Really, just to finish by saying the government have put a poster out as well. There's the COVID Secure poster on Google. It's a very complicated link with lots of noughts and ones, so I'm not going to display that. But if you search COVID Secure poster on Google, it will come up. It's a good way for you to demonstrate that you are maintaining COVID Secure principles. And really, that's it. So I'll hand over to questions. Any questions?
Thanks, Andy. So we've had a couple of questions come in. I know it's 10:59, but there are a couple of really good questions, so I'll ask them. If you can't stay, feel free to leave, and thank you so much for attending. So we've got one from Duncan Smith. What are the rules for having 2 members of staff sitting in a van together, i.e. only 500 millimetres between them on the front seat?
If they are in a small van, for instance, and they aren't able to maintain social distance, the guidance says that you should have windows open, for instance, both sides, windows should be open, full ventilation. Now, you don't say how many seats the van's got, but generally the advice is if it's like most panel vans, for instance, tend to have 3 seats in the front, and they'll have the driver, and then there's 2 seats next. Generally, the middle seat you would ensure is left clear and not in use. And the other person sits closest to the window. That is the general advice at the moment. But it's making sure that the 2 people that are in that van together don't then mix with other people, and that are being separated, if you like, and working as another pair with somebody else. They stick together. Really, that's the general advice at the moment. I hope that answers the question.
Thank you. And then we've got another question from Ben Osborne. We've implemented social distancing measures within our office for the return to work. As much as shuffling desks has been possible, are we able to implement less than 2 meters where people are working back to back?
if people are working back to, I mean, the advice now, as we know, is where we can't achieve the 2 metre distance, 1 metre plus is possible. We're able to do that as long as we've got mitigation, and certainly people working back to back would be a mitigation measure as long as they're not too close. But certainly working facing away from each other is most definitely a control measure. You know, people working, like I said, diagonally from each other is again another area that we would look at. Good hygiene standards, so making sure that perhaps we've got you know, really good standards for cleaning the area down, make sure that we've got really good ventilation in that area. Even things like, you know, having doors open. Typically we wouldn't advocate, or, you know, and I still wouldn't advocate having fire doors propped open, but at this time obviously having doors to allow extra ventilation at the minute is a really good thing. As long as we're able to manage that through the fire risk assessment and ensure that we aren't putting people at risk, and there isn't a risk of, you know, fire spreading if there was a fire, for instance, a system where, you know, if there's a door that's been propped open, as soon as an alarm goes off, somebody shuts it. You know, there's no reason why we couldn't look at that, as long as we've taken that into account on the fire risk assessment. But yeah, good ventilation, make sure that we clean people back to back, brilliant, all good things.
Thank you. And we've just had a last minute question come in from Rachel Della saying, will the slides be available to review / print?
I think what I've done is I've started to put together a guide based on basically what I've spoken about, and the key areas I've put into more of an easily digestible guide rather than slides, because I often think myself when I attend things that slides don't mean all that much to other people that weren't present, because a lot of it's just images and things like that, and short, you know, snippets of information on there just as almost prompts and images when I'm talking about. Whereas I think with a guide, it enables me to give you that little bit more information then. So that's what I was hoping to do. I'm sure if you really want the slides, I can send them, but yeah, I think the pack would be more useful to you. But
fine. So yeah, Andy, if you share the pack with me, and then I can send it out to everyone that was on today, and we'll also circulate it out to our members as well. So just thank you so much. It was very informative. I hope you all enjoyed yourself. Sorry again for being a few minutes late, but I think those questions were really valuable. So yeah, thank you again for attending. We've got another webinar tomorrow, HR Flexible Furlough. So if you're free, feel free to register. And yeah, thanks again, and hopefully we'll see you on one of our webinars soon. Bye everyone.
Thank you. Bye.